ASA classification. So in ASA, we have the patient's classification. So ASA 1 is when any normal healthy patient is ASA 1, non-smoker, non-alcoholic, right? Everything is healthy, right? Then ASA 2, when the patient has mild systemic disease or significant health risk factor is present. ASA 3, when there is a severe systemic disease that is not incapacitating, right? So there is a disease, but that will not cause any threat to life. Okay. But in ASA 4, you have the severe systemic disease that is a constant threat to life. Okay. Then next is a morbibound patient who is not expected to survive without the operation. So in the exam, you will most likely get the 3, 4, or 5, right? Sorry, sec 2, 3, or 4. So 5 and 6, you will not get these patients mostly in exam. Okay. Morbibound patient means he is admitted in the hospital, he's undergone any surgery or will be undergoing any surgery, right? So these are not the patient who will be visiting to you in the dental clinic for any elective treatment. Okay. So most likely there will be some emergencies for which treatment will be required. So not very common. Then 6, the patient who has been declared dead. Clear? Okay. So what is there in ASA 1? ASA 1 is normal healthy patient, like your healthy, non-smoker, no alcoholic use patient. ASA 2, when you have a mild systemic disease, right? So mild systemic means pregnant patient, right? The patient is drinking alcohol. He is having hypertension, but that is under control. He is having diabetes, but it is under control. So well controlled diabetes. Which type of diabetes is? Type 2 diabetes. Okay. Then pregnancy, obesity, right? So well controlled diabetes, hypertension, mild lung disease, current smoker or alcohol drinker. These all are ASA 2. Then comes ASA 3, where you have a moderate to severe systemic disease, right? So in this you have poorly controlled diabetes, hypertension poorly controlled, then COPD patient, active hepatitis, alcoholic dependence disorder, right? Then the patient is having some pacemakers or any patient who had the cerebrovascular accident, right? Angina, MI history of the patient, these all come under your ASA 3 category, right? So here the ischemic attack, that is angina MI, history is ASA 3, but if it is recent history, that is less than 3 months, that come under ASA 4. Okay, so mostly in ASA 3, you will be having the controlled cases, right? All the controlled cases. But if you see any recent medical, like hospitalization because of any medical problem, those come under ASA 4 because they will be unstable patients. Okay, so these are constant threat to life, right? So recent MI, CVA, right? Transischemic attack, stents, so any ischemia, valve dysfunction. So all these will be ASA 4 category. Then 5 and 6, not that important. Is it clear? Right? So one controlled, right? So in medical question, you won't be getting these ASA 1 questions also. So most important are your 2, 3, and 4. Just go through these properly. Okay. Normal, healthy, pregnant patient, anxious patient. The patient say, I am having anxiety for the dental visit, right? Phobia, right? So these are also ASA 2 category. Clear?